lawmakers have been looking at Governor Josh Shapiro's $54.5 billion budget this month during hearings, and some legislators, particularly Democrats, have said they're concerned about what might happen if there are big cuts to federal funding, as well as potential freezing of grants as well that could potentially affect projects here in the state dealing with transportation, as well as increasing health care costs at a time when the governor's budget calls for a $2.5 billion increase to Medicaid. Unionized healthcare workers rallying on Thursday in Camp Hill, saying potential cuts to Medicaid could hurt their workforce and patients.
They have a right to safety staffing, and they have a right to have, basic needs, supplies.
State Representative Dave Madsen says he's also concerned about the future of a $500 million grant in funding to replace the I-83 South Bridge in Harrisburg.
I am hopeful that we get a formal answer saying those funds have been committed and that we can rely on them, so that just puts the conversation to bed. We can build the bridge and go about our life here in South Central Pennsylvania.
But some Republican lawmakers say it's long overdue that both the state and federal government take steps to greatly rein in spending.
A tremendous risk for us to continue to rely and continue to say we'll just keep federalizing these Medicaid dollars for matching. Like, the gravy train is over. It's time to come to reality. We can't afford what we have anymore.
Representative Seth Grove pointed to what he said has been determined to be a multi-billion-dollar structural deficit in Pennsylvania. He's also said that the state has to really try to avoid drawing down on its reserves like the rainy day fund to ensure that they don't have to tax residents in the future at a higher rate to help pay for the cost of government. In Harrisburg, Tom Lehman, WGAL News 8.